Hello everybody, my name is Shannon. I'm a registered nurse and I've been nursing since 2004. I'm here to tell you today that if you make poor decisions, where you may end up, and that could be potentially in this emergency room. So what I'm going to do today is I'm going to give you a scenario about a boy who is 15 years old. His name is Casey. He was drinking with some friends at a house party, decided actually to walk home, but was texting while walking across the street. So from there, he got hit by a driver and was on the street. So let me just ask you guys, think for just 1 minute, what is one thing that you would do if you came upon somebody in the middle of the road? If they weren't moving, if they weren't breathing, what would you do? Well, I hope number one is one thing that you guys all thought of would be to contact 911 instantly. Everybody has cell phones. If you don't have a cell phone, but one of your friends has a cell phone, get them to dial 911. It's really important when you contact 911 is to give them the information that they need. Look for landmarks. Hopefully you know where you are. If you know your buddy's name, give their name. If you know any medical conditions about your friend, let them know that. Let them know that you have been drinking or if you've used any drugs. That is really important. The other thing is that you might know if they have any allergies. They might ask you questions about how he's looking. Is he breathing? What kind of things are wrong with him? If you can give the most detail to the 911 operator, that's really important. So then what happens after that? 911 is dispatched. They come. The ambulance personnel will bring Casey into emerge, and here we are. We're in the emergency room. So this is when things get really busy. There's going to be doctors in here, there's nurses in here, there's lab techs, there's anybody that we could actually call to come in to help us because we really need help, we need it fast, and we need lots of hands. Everybody comes in to lend a hand. Everything is happening fast. I'm going to kind of go through some of the steps, and everything happens simultaneously, and we try to do the things that we need to do most important first. So number one thing is we need to see what's wrong with you. You've come in, we've got a little bit of history, but not a great amount. So what happens? Basically, you come in here, we take this off, if there is a sheet anyway, and we figure out what is wrong with you. The first thing we do is we need to see what's happening. As you can see, there's no pants here. That has probably been cut off in the ambulance. They don't care if these are your designer jeans, your favorite jeans, anything about that. They need to see your body. We don't care what area is exposed, and we just need to see. We take the rest. We'll take our scissors. We cut off anything else, and then we open up everything. We need to get a head to toe visual on you, and we need to see what's wrong so that we can help you. That's our number one goal. So when Casey first came in, the ambulance personnel just had some oxygen on him. It's a little cannula like this, and all it was is in here, into the nose and around. But as the day kind of progressed, and as you can see, I don't know if you can see well there, but he has a head injury. So some of the things that may happen, we might start with something simple. Then we might move on to a mask. So this is all oxygen things that we may use, you may see. And if worse comes to worse, we have to put an airway in. This is a small one, but then we do have a larger one. And we call that an ET tube. So what happens is the paramedics or the doctors will intubate. So this is a tube that will go down in through your mouth, and it'll sit like this. We inflate this cuff, as you can see, and that sits in here so that we can breathe for you if you need. So what happens with this is then they attach what we call a bagger onto this, and what we will do is we will potentially bag the person. So what we'll do normally is we get somebody doing this, and they will give the breaths as needed. We also will have a monitor on, which is over here, and that'll show what your oxygen level is, that'll show your heart rate, it'll show your blood pressure, and that all kind of happens at the same time. So this is just one of the parts that we do to make sure that you are breathing. I just have to put things down because I don't have hands to help me out. what we'll do after that is that we have to make sure that your blood is circulating. You can see not necessarily your blood circulating, but we need to make sure you have fluids. As you can see, Casey had numerous injuries and he's bleeding from all of these orifices. So what we need to do is make sure we get fluid into him. We have IVs up here set up, and these are the IVs that we use. So I don't know if you can see in the video, but they are called large bore IVs. We want the biggest needle that we can get in. Usually like to get at least 2 of these in. This is important because we have to get the fluids put in because he is losing fluids. If we cannot get an IV, and that does happen often just because of the trauma, as you can see, he's got a laceration on his arm. His veins are probably not very big because he doesn't have so much fluid, and that is leaking out. What we can do is it's called an IO. So what this is, it's actually a drill, and like it is a drill that they can drill into a bone, and they put in a large needle, which it's very thick and quite big, and it goes directly into the bone. And with that, we connect fluids to that, and that's how we give fluids that way. This is quite painful. You might be awake if we have to do this, but we gotta get it in. So yeah, it hurts a little bit, quite a bit actually, but we need to figure out and we need to get fluids into you. So this goes into your bone, we connect it, and that's how we go about that. So some of the other things that you might see, or depending on what's happening, we might have to do, in Casey's case, he started where he couldn't breathe. He started not becoming a little bit more unstable, as we would call it. So they had to actually put in a chest tube. So what happens, awake or not awake, because the problem is when I say awake or not awake, we can't sedate him. And one of the reasons we can't sedate him is because you see there's a head injury. Sedate means kind of like put to sleep to be able to do these procedures, because that might be something you're thinking. Why wouldn't you put him to sleep and then do this? It's because we have to monitor how he is doing, and does he have a head injury or not? And if he's asleep, we can't tell what's happening. So what will happen here is they will take a scalpel and they will make a cut in the side of his chest. So they basically make an incision in the side of his chest, and then they take a chest tube. So if you guys can see this or not, it's kind of like a big, pokey, sharp-ended thing. And it's silver and it's hard, it's cold, but it is strong. It's over top of this plastic. So what happens is we poke into the chest, and then we feed the tube through and pull this out, the stylet out. After that, we connect it to a bag, and then we can see how much drainage there is in that area. So the other thing that might happen is we say it's really important for us professionals to figure out how much fluid you lost as to how much fluid goes in. And I talked about the IVs, so we know how much fluid goes in. We can tell by that. But what we have to do is how much fluid comes out. Not sure if you guys have heard this or not, but it's called a catheter. So what it is, it's a tube something like this. So it's a long hose-like apparatus, and it goes into the urethra. So boys, it goes in through the penis and up into your bladder. Girls, it goes through your urethra, up into your bladder. And then what we do is we inflate the balloon once it's in your bladder, like so. And what we do after that is that little ball stays inflated and it sits into your bladder like this. We connect it to a bag, like so. And then on this bag has measurements. So what it tells here is how much is in there, how much fluid's in there. It tells us the color, can tell if you've been bleeding. We can see all sorts of things with this. Some of the other things the doctor may have to do is called a rectal tone. So we will roll you over once stable. The doctor will check a rectal tone. If you guys are wondering what a rectal tone is and how it's done, They basically take their fingers, put them up your bum, and see. The reason they do that is to assess for spinal cord injuries, to see where you can feel and how much you can feel. If you make bad decisions and decide that you overindulge in alcohol, where you come into the hospital here and you need your stomach pumped, we do put in NG tubes. So that's called a nasogastric tube. It's a tube that goes in through your nose and sits in your belly. What happens then? All of the stuff that you've drank or eaten, whichever, it will come out into that bag. That tube looks like this. This is actually a smaller tube than we normally use, if you can see that. And the reason we need quite a large tube is because we got to get everything out quickly. It goes into a drainage bag and it is very uncomfortable. And this will empty out anything that you have in your gut. So that's a few things that we could do while we're in emergency here. So after we stabilize here, as much stabilizing that we can do in our little rural facility here, then we get him ready for transport. So we could potentially call STARS, we can call a higher level of ambulance, we can call anything to get them to where they need to be. In this case though, because of Casey's injuries, he did not make it to be able to get transferred out. He died. So then what we do after that is we package up his poor broken body. We cover him up. This is quite an important thing. We have to get a hold of Casey's parents. To me, that's one of the number one things that is something that I really want everybody to think about. Does everybody right now in this building have ID on them? And if you answer no, I mean, that's just something to think about, to have an ID with you so that if you do get into any kind of accident or you end up making poor decisions and come here, that is something that we will be able to know how to contact your parents. Fake IDs? Can you imagine if we had to phone the number or whatever the person's name on that fake ID and have to get in contact with that parent and tell them that their son has died? Don't think that's fair. The other thing I want to bring up when we're talking about this, most of you guys have cell phones, and you can look at how to do this, how to activate your emergency button so that you can push that and it directly calls 911. There's also something else called ICE, and what that is in case of emergencies, so that you have somebody with the letter ICE in your phone so that people know how to contact who is most important to you. So once Casey's parents come in here and see him, what happens is then we put Casey into this bag. And we take him down to the morgue. And that's how you would end up being. I want everybody to think about something. Just because you're young, you're not invincible. We don't purposely try not to help you. It's usually often that your injuries are too severe for us to help you. I can guarantee you, if you make poor decisions, that this could be someplace that you could end up. And this is hopefully where I never get to see any of you. Thank you, everybody, for taking the time to listen to me. And please, make good choices.